Hello and welcome to the first session of today's McKnights Online Forum. This morning, we'll be talking about the ongoing workforce crisis and what could be ahead for long-term care providers. Join us as we explore, will the recession be good medicine for your staffing ills? I'm McKnights Senior Editor Kim Marcellus, and I'll be moderating this event. I'll introduce our speakers in just a moment, but first we have some housekeeping to take care of. If you have any audio problems during today's presentation, please first check the volume control on your device. This is the most common cause of related problems. You can also use the help button if your own troubleshooting efforts don't work. We will have time for a Q&A session near the end of the presentation. If you have any questions, please feel free to go ahead and start submitting them right now in the box on the left side of your screen. Today's slides are also available to download and print. You'll find those on the left side of your screen too, under the Handouts tab. Now, regarding continuing education. This educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards. It has been approved for 1 clock hour. However, you need to stay tuned into this event for its entirety during this original broadcast to receive a certificate. You can track CE requirements through the course completion tracker, which is accessed through the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display, and the required viewing duration will have a green checkbox. You can then view or save your certificate. A copy will also be emailed to you afterward. Finally, this session and all of those in today's online forum will be archived and available on demand shortly after this live event. You can access them again or share them with others for the first time simply by going to the registration page and re-entering the studio. The URL is www.mcknights.com/082522 online forum. Now, let's meet our presenters. David Copins is co-founder and CEO of IntelyCare. Under David's leadership, IntelyCare has grown to work with more than 30,000 nursing professionals and 16,000 healthcare facilities, including many skilled nursing operators. He came to staffing after holding leadership positions at other large organizations, including Virgin Pulse and UPromise. Ben Tanglson is Vice President of Data Science at IntelyCare. Ben is focused on projects related to pricing, personalization, and market balance. His research helps improve IntelyCare's apps to better serve nursing homes, other healthcare clients, and nursing professionals. We're glad to have them both with us today. And with that, I'll turn it over to you, Ben.
Thank you, Kim. Super excited to be here, and thanks everyone for joining us this morning. Our agenda is as follows. I will kick us off by talking about some basic economics and how changes in the labor market affect the nursing home industry. I'll then hand it over to our CEO, David Copins, and he'll talk a little bit more about some strategies that we can take knowing what we know about the economy, and then we'll end with all your questions. Looking forward to that. But first, why are we even talking about economics and recessions? And I think the question to start with is like, are we in a recession right now? And the official economics PhD answer is no, we're not officially in a recession. But things are officially getting weird in that some economic indicators are indicative of a shrinking economy or a recession, and other economic indicators are indicative that things are doing great or that we're even improving. So this chart here shows gross domestic product and how it's changing quarter to quarter. Gross domestic product is one of the most popular economic indicators of how good an economy is doing at making stuff or providing services. And you'll see in this chart that the gray areas, the gray vertical bars, are the official economic recessions that we've had since 1990. And the blue line is negative or below the black line at 0 when the economy is shrinking. It's above the black line when the economy is growing. And you'll see that during these gray periods, the blue line goes below 0, which is just to say that we're in a recession when the economy is shrinking as measured by GDP growth quarter to quarter. But if you look at recently, the past 2 quarters, we've had declining GDP, and this is largely considered an indication of a recession. So this is like one indicator that's saying, all right, things are starting to go bad for the economy. There are other indicators, though, that say things are going pretty well. So this is unemployment by month, and you'll see that unemployment usually goes up during these recessions. And recently, unemployment has been very low. We've completely recovered from the increase in unemployment from the onset of COVID, and we were down below 4%, which we had just before COVID. But before that, we didn't have unemployment below 4% for decades, many decades. So kind of record-breaking low unemployment. And this is a sign that the economy is doing very well. So what does that all mean? If you ask a panel of economists, you'll get an answer like this. So this is from the National Association of Business Economists. This is a society that I belong to, and every month we get surveys about what we think is happening in the economy and how do we think about these different economic signals that we're seeing. And you'll see that about 1 in 5 economists think that the US is already in a recession. That's 19% here over on the left. But then between 40 and 50% of economists think that we're not officially in a recession right now, but we will be soon. So maybe this quarter, next quarter, or the quarter after that. And then some other economists will think that, maybe because unemployment is so good, we'll do just fine, and there's no need to think that there's a recession happening right now. So that's kind of the state of the economy right now, and happy to kind of dive into any of this more at the end. But now, what does this mean for nursing homes? And we'll answer this question through a number of other questions. So are nursing homes recession-proof? How does the labor market dynamic change for nursing homes during a recession? If we have time, we'll talk about the gig economy and how that might fluctuate during a recession and what that might mean for the long-term care space. But jumping into this, are nursing homes recession-proof? Now, when we answer this question for any industry, there are 2 channels that we look through. The first is the consumer market, and the second is the labor market. Based on the consumer market, nursing homes are pretty recession-proof. During a recession, you'll see a decline in personal expenditures, especially discretionary spending, but that doesn't really apply to nursing homes so much. You'll see substitution of expensive goods for cheaper alternatives. So as pictured here, kind of more ramen and less caviar. That might affect the long-term care space a little bit. Some families might decide to provide care at home instead of seeking out professional care. But this is the consumer market is not a major factor for the long-term care space so much. That's not true of healthcare in general. There might be discretionary spending in healthcare, might be elective surgeries or other niches within the healthcare space that might be more exposed to fluctuations in the consumer market, but not so much in the long-term care space. The labor market, however, is a different story. And the labor market is more than like recession proof, but recessions are actually a good thing for nursing homes. And why is that? It's because there's less competition to hire, and finding and retaining staff is a major headache for nursing homes. And so less competition in the labor market is a good thing. There's one particular detail that's, I think, especially interesting, and that's job mobility during a recession decreases a lot. So there are fewer people quitting their jobs. There are fewer people switching jobs. There's less on-the-job search for other jobs. And a lot of that is because there are fewer companies hiring and there's less opportunity to switch. But this decrease in turnover of staff is a good thing for nursing homes because, jumping to the next slide here, lower employee turnover results in better quality of care. And so there's this interesting study, paper published in 2019 by Huang and Blobless, that looks at changes in unemployment rates. They compare that to the data that's collected by CMS. They find that higher unemployment rates lead to lower employee turnover, and lower employee turnover results in better quality of care, specifically fewer deficiencies, lower deficiency scores. Summing this up differently, you can just say that nursing homes benefit from decreased job mobility because there's less turnover, fewer outside options. Your nursing assistants are not lured away by jobs at Target or retail or other places. Like, people tend to stick with the jobs that they have. And people who are unemployed and looking for jobs tend to be less picky during a recession. And so really the leverage sort of tilts in favor of the establishments that are hiring during a recession. So that's the first question. Are nursing homes recession-proof? And generally the answer is yes, and then some. And not only are they recession-proof, but they stand to benefit from the labor market fluctuations during a recession. Our next question, how does agency staff usage change during a recession? Now, this chart here is for all industries, but you'll see this blue line here is unemployment. This orange line here is the percent of the population employed by staffing firms. And you'll see that as unemployment increases or goes up, the percent of the population employed by staffing firms decreases. And as the percent of population employed by staffing firms increases, as you see it increasing from 1990 to 2000, you see that unemployment is declining over the same period. It's like these lines are almost mirror images of each other, and as one is going up, the other is going down. Why is this? There are a number of possible explanations, but it's easy to think that establishments that use agency staff less during an expansion because, during a recession, because people tend to be downsizing. And who do you downsize first? You downsize your temporary or your agency staff first. You keep your full-time employees. And as the economy is growing and as your establishment is growing, you bring on more people and you're more open to bringing on agency staff. So, and what does this mean for nursing homes? This is also good for nursing homes because there's less agency staff, there's less turnover, and you're in a better position to be fully staffed using your full-time and part-time dedicated employees or other more dedicated staffing arrangements. Last question on kind of just the labor market and what it means for nursing homes. What about the gig economy? And the gig economy is referring to basically work that people do through their apps. It's your Ubers, your Lyfts, your DoorDashes, and people get to really work when they want. And it's this really flexible way of working. It's pretty new in that most of these businesses that we are familiar with were started during or immediately after the 2008 recession. And the past kind of decade and a half has been a big boom in this innovation along the gig economy, where many new firms and businesses have entered during this period. We haven't really seen how these businesses will react during a recession. The only recession that many of them have experienced is the COVID recession, which is really obscure and unique in many different ways. And so, but what we do know is from these two papers cited down here at the bottom, where higher unemployment does not necessarily lead to higher enrollment in the gig economy. So if unemployment goes up and people become unemployed, they do not enroll as Uber drivers en masse, or they don't enroll as DoorDashers en masse. This is not something that we've seen over the past 15 years. But what we have seen is that those who already participate in the gig economy do participate more when unemployment goes up. And so among the gig economy workers, there's this kind of stretchiness, this flexible choice of how we spend our time. And that increases during a recession, not necessarily a mass enrollment in these gig economy businesses.
Hey, Ben, there was a question.
Oh, sure.
There was a question about, what is the gig economy? And I think you pretty much explained it, but maybe give one more, explanation of what that means.
Yeah, sure. So the gig economy is, we think of as kind of work when you want businesses. So Uber is a good example. You get to drive when you want, and you just kind of fire up the app and say, I want to work right now. And then you go work for as much as you want. Or DoorDash in a different way. IntelyCare is participating in this gig economy. Same with, ShiftKey, Clipboard, and some of these other kind of techie staffing agencies. And this is what we think of when we say the gig economy.
Great.
So let's see. So in summary, everything that we've spoken about so far is kind of backward looking. What do we know from the past 3 or 4 recessions, and what are some patterns that we've seen, and how does that affect the long-term care space? The question is, if we have a recession in the next few years, will it be different? And there is a legitimate case to think that it could be different this time around, because COVID changed everything. And COVID, I think, was an enlightenment to many of us that, yeah, jobs are important, but so are other things. And this is true of all industries, but also true in healthcare. So this is from a number of surveys that we've conducted, where basically all nursing professionals rank maintaining work-life balance as a top concern. Almost half of the long-term care workforce have considered permanent job changes to flexible roles. Almost 60% of nursing professionals who left their jobs cited understaffing. This quote from Maggie is an interesting one. She says, as a single mother, I have to make sure I can support my kids financially, still be there for them without worrying about my work schedule. And so nurses want flexibility, and COVID, if nurses wanted flexibility before COVID, after COVID, they definitely want this flexibility. And we see that in a number of other surveys that we've done. So we see this in a survey that we conducted with women, and we asked the nurses working for us why they chose to work for us in a per diem capacity. And flexibility was the number 1 and number 2 reasons. When we ask nurses what's the most important criteria when selecting an employer, pay is right up there at number 1, but flexibility and work-life balance are close 2 and 3. And so when we're thinking about how to attract and retain staff, pay is obviously important, but that's just one lever, and flexibility is another important lever. So in summary, and then I'll hand this over to David, recessions, what we know looking backward, are a great opportunity for nursing homes. There's less competition for recruiting and hiring. There's less turnover, which leads to higher quality. We also know looking forward that COVID exacerbated the need for flexibility. And with school closures and health emergencies, understaffing, work-life balance became more important than ever, and this is best achieved with high flexibility. So this presents kind of an interesting question. If a recession is an opportunity to kind of, lock down your staff and be fully staffed and hire the people that you want, but if flexibility is also really important, the strategies to manage economic downturn becomes very nuanced, and this is something that we've thought about a lot. And so I'll hand it over to David now, and he can talk about really what do we do to kind of thread the needle on these issues.
Okay, great. Thanks, Ben. I think I saw at a recent conference, LTC 100, there were a number of, I think they were C-level folks from various nursing home chains that were making a presentation. And one of the bullet points on the last slide was pray for a recession because there's this belief that in fact, a recession will be quite valuable to the long-term care industry, and I think that our in-house economist Ben also believes the same thing here, and as you see, because just the turnover reduces, people are willing to work, in a more extraordinary way. However, I think the difference that we've seen this time around, and by the way, I guess it's still unknown if this recession is actually happening or when it's going to happen, and if it's going to manifest itself in the same way, particularly since the unemployment is so low at this stage. But one of the things that we've discovered or learned kind of pre-pandemic, about 18% of the workforce, meaning everyone that worked in the long-term care industry, and this was also pretty consistent in acute as well, but in long-term care specifically, about 18% of that workforce really wanted to have flexible opportunities. They needed that in their lives, or certainly highly preferred it, and that, largely those were the people that ended up working for agencies, or another company might have a pretty active float pool, and that gave them the kind of flexibility that they needed. However, things have changed. And I think that one of the things that we heard and saw through multiple surveys now, and various discussions, is that the workforce, and this is recent, this isn't just during the peak of the pandemic, but recent, the sentiment is that 40% are still looking for a high degree of flexibility. Now that complicates things quite a bit. So if you look at this and realize, well, pre-pandemic, let's say that you only offered as a long-term care facility, if you only offered full-time and part-time schedules, and that those schedules were planned out, that you were recruiting from about 82% of the workforce. You weren't recruiting from this 18% because they couldn't work under those circumstances. But if we believe what we're seeing in the market, and we believe that their respondents, the 40%, are really sticking to this, that currently the long-term care industry is recruiting from only 60% of the workforce. And that's pretty damning when you consider how short-staffed everyone is at the moment, and how do you start to access this 40%? Well, a recession would actually shrink the 40%. People that prefer flexibility but don't absolutely need flexibility will be willing to take on schedules, and this number would start to shrink. But I think from everything that we've seen so far, it's not going to shrink back to that 18%. So I think the current question is, all right, how do facilities then recruit and get to more fully staffed, or rather, how do we eliminate agency kind of out of this, out of the equation, in the current environment? And I think the solution that we've seen work very well now is creating your own float pool, or call it even a mini agency, that to make that work for yourself, so that you can create flexibility that 40% of the workforce is looking for. Yet they're still your own employees. They're still trained in the way that you want them to be trained. They're still, feeling a connection to your company. But if you've had experience with this in the past, you've noticed it's also pretty challenging. I think the word "doesn't work" is probably a bit of an overstatement. Some facilities have been able to make it work quite well. Some have tried it and it just didn't work, and then they dropped it. But all of these things are relevant. Obviously, it's very difficult to try to manage it perfectly well through spreadsheets and phone calls. The current scheduling systems that are out there are not really designed to manage float pools in the most in the most efficient way. They're supportive, but it's not really kind of built for that purpose. I think the other challenge is that there's still a communication gap of trying to let people know easily about which shifts are open and how to engage that float staff, how to engage them easily, without a phone calls and text and just a constant participation that way. And just last thing we heard in this. Last thing we heard, in various roundtables, was that the float staff that they had tried just ended up cherry picking the best assignments, and the permanent staff, really had to kind of go after and fill in these other assignments. Okay, so let's talk about what are the how do you handle that? I think one of the things that is now available. So there's software that's now been built, and there's a number of there's a small handful, I guess, of companies that have built software specifically for float pool. And I think that one of the exciting things is that they are really designed specifically for this scenario, meaning either for a single facility to kind of build their own float pool, manage it, communicate with them, or even, and then this kind of goes on to suggest the more preferred, or the best case scenario is that you can actually use your pool of people to run across different facilities that might be within a reasonable driving distance. So the software is created for that, apps are created for that, and that's the good news, is this is possible to be done in a way that really matters. One that we're quite aware of uses predictive algorithms, because the idea is that you want to be able to predict where the open shifts are and what the needs are going to be based upon the difficulty to fill, and that it can target specific staff that are most likely to fill those, instead of just a blanket open communication to everyone about all of the open shifts, which sometimes feels a bit overwhelming and doesn't actually target or get to the right person that can most likely fill that particular shift. And then the other nice thing is that if you think about it, previous incarnations of float pools where they were cherry picking the best shifts, that can be mitigated by say making the pay rate somewhat dynamic based upon the difficulty to fill a shift. So the least desirable shift should be paid higher. It should. And anybody could be open to take that, but it should have a higher pay rate associated with it. The problem is, and I think most people agree with that, but the problem is that trying to do that on a shift by shift basis is just, the management of it is quite cumbersome. It's very difficult to try to do that. But this software and others I know are saying, hey, let's try to make it such that there is a specific incentive that's designed based upon what the software already understands is the difficult shifts to fill and so on. So it's pretty effective from that standpoint. Again, the other is just around the communication element. I mentioned apps, that this is the most effective way of kind of creating engagement with that pool. One of the other things that we've heard quite often is, geez, I've got 100 people in my float pool. I have all of these open shifts, but to get people to engage with it is really difficult, and oftentimes still means I'm using my personal phone to text with them, or we're trying to call people and trying to get them to engage, and it just is a very cumbersome process to do that. But using kind of a purpose-built software will help with that. The other element here is that it's easy to make schedules, and to simplify those kind of communications. And then obviously when it comes down to the element of being very specifically targeted, the various algorithms can also match with the best staff to kind of fill that, as well as the pricing to kind of make it most enticing. I think one of the other elements that's helpful when you talk about float pool management software specifically is that the corporate users or management have a lot of data available to them and can be used to both kind of see what's available and put controls over it. You can kind of track the engagement level of each of the staff members, et cetera. So there's a lot of ways to think about this. So I know that when we first started talking to people about one of the best solutions to try to compete with the alternatives that are out there, and our company certainly is one of those, is to create a float pool. People had a tendency to just turn off. Their mindset was, oh, we tried that, it didn't work. I think that the previous solutions were probably very difficult to do that. But imagine if you were able to use the same platform, the same software that companies like ours use to manage our 50,000 nurses and CNAs, that you could use it to kind of create and manage and engage your own staff and your own float pool. Then all of a sudden it should start to become more clear that in fact, well, this actually could work. If I had those capabilities, I could compete head on with any other particular agency out there. And that's the message I think that we're trying to get across is it is possible. We think that if you're looking at the fact that you may be only recruiting from 60% of the workforce today, the way to get to a point of being at 100% and fully staffed and eliminate agency is there really has to be some element, a portion, and maybe it's 20-25% of your total workforce, but that are that have access to high flexibility staffs. And of course, my my advice to everyone here is, who are the best people to hire into your float pool? Well, I'd say go after the nurses and CNAs that are working at staffing agencies that you may employ. So I know that sounds funny coming from us, but those are the hottest targets, I would say, to kind of put into your own float pool. And then let me be really blunt. There is a world here where there's not enough staff to go around. And we certainly as a company that provides flexible staff, we've created a way to try to make it attractive. And I think that what we're saying now is it doesn't have to just be us versus them, or you hiring versus us. Rather, it can actually be something that you become quite attractive and can compete and actually offer the kind of flexibility that that works well. I think the biggest advantage that that you will end up having over anything that we could offer is that sense of community of your own, being part of your own facility and your group of facilities, and that being part of that is a pretty significant, advantage that you can bring to the table here. I think part of our recommendation then is also just to make sure that when you do offer the flexibility, that you can provide it in such a way that there's still some unique incentives associated with taking the hard shifts, that you can still offer some degree of training, in your facility and your standards and your own operations. If there's other types of benefits, even if they're not working full time, you don't need to provide them the full benefits, of course. But if there's some things that are low cost or associated with what you offer, that would be an opportunity to kind of make them feel part of that group and feel part of your team. So that's the primary recommendation, I think, is that somehow you're going to want to try to create or compete. And I'm going to skip back real quick back to this idea that the world has changed. It's not going to kind of go back here where most facilities were able to be fully staffed, unless there's an offering that you can provide to that flexible, the people that really want flexibility. It's going to be extremely difficult to get back to fully staffed. So that's the primary, that's our presentation today. So there's been a number of questions, which is awesome. And I will let our moderator come back in and take it from here.
Yeah, sounds good, David. Yeah, definitely a good number of questions today. So I'm going to pick on you first and kind of stay with what you were just talking about, those three prongs on your last slide. Danny is asking essentially about people who are gigging as CNAs and this idea that it can be very attractive to just jump whenever a higher hourly wage is dangled from another facility nearby. Can you talk to what that looks like now? Maybe, the trajectory, is that evening out? Are you seeing less of that? And what would happen in a recession to those kind of offers?
Yeah, I think that, anybody who lived through the 2008-9, recession can attest to the fact that there was less kind of employee turnover. People weren't jumping quite as much, and they were willing to adapt to whatever the employer needed. I still think there's a lot of unknowns about whether or not the recession is going to be as extreme as what we've experienced at that time, and or even if it manifests itself in a traditional type of recession. I think that the question is a really good one, and I think that I think that it's always difficult when one facility is offering another 50 cents or more per hour. I think when it comes back to to the extent that you can offer flexibility, even if they're not part of a float pool, try to create some method of communication and community among your own staff. And people are going to be less likely to kind of jump for 50 cents an hour. It does come down to culture. And I know that you've heard this probably a zillion times, but but the management, the administration that demonstrates that they really care for the staff. And in particular, in your director of nursing world, that they demonstrate that they care about their CNA staff and they recognize how hard a job it is and the importance of the job. Those things go a long way to retain staff. Now, when it comes to just back to this idea of, well, maybe they're jumping not necessarily to another facility, but to an agency, that I think the way to combat that is through offering a similar offering yourself and utilizing the new technology, the new tools that are out there now to create and manage a float pool that gives you that kind of, a very competitive offering at that point.
And I kind of wonder from a sociology perspective, I'm someone who freelanced for a decade, and anytime there was talk of an economic downturn, my thought went to maybe I better get a job because there might be more security for me if I have an employer rather than working these gigs, which may dry up. Do you think that could happen too, that those offers will just diminish a little bit if we truly are in a recession?
Yeah, Ben, why don't you chime in on that?
Yeah, no, I agree. I think that is there is more risk when you switch jobs during a recession. And there is also risk in moving full time to a gig economy type place. It is just a less predictable stream of income. And especially if recessions are good for nursing homes and kind of tilts the bargaining power in their favor, I think that you would see less of this type of behavior during a recession. There was always going to be some people that still do this. It'll never completely go away, but I think that you would see less of this during a recession. During an expansion, the bargaining power kind of tips in favor of the employees, and it's like, well, I've got 10 options, so you got to make me stay, or I'm just gonna work here or there. There's just so many options that there's a lot of safety in moving to a new opportunity.
Yeah, you're going to seize it while you have it. I'll stay with you, Ben, because I wanted to go back to one of the very first things you talked about. The question is from Julie, and she asks if nursing homes are recession-proof, how can that be if families are deciding to care for folks at home due to their economic status? So can you just kind of cover that again, and maybe the idea of how that would or would not significantly impact census?
Yeah, so it can... nobody is completely recession-proof, but some industries are mostly recession-proof, and every recession can be a little bit different. And even each nursing home is a little bit different depending on the type of people that you provide care to. And so, yeah, Julie, you make a good point. And this would fall in this kind of consumer market here that I said was not a major factor. But yeah, people will substitute and do things more on their own. Like I'll cut my own hair instead of going to get it cut somewhere else, or I'll go.
You're a brave guy, Ben.
That explains a lot, Ben. You cut your own hair. Yeah. Okay, got it.
Yeah, it's to the detriment of many other things in my life, but this is a substitution that I make when I want to save money. And so yes, people will do this, but it is not. And for some nursing homes, this could be a major detriment. But for many other facilities in the long-term care space, especially if you're getting a lot of referrals from hospitals, if you are getting, there is a portion of this market that is just going to happen no matter what. And I think it kind of bends before it breaks, and you cut your own hair for a while and you provide care within your home for a while. But then it reaches a point where you say, all right, we need professional care.
I think you have to look also back at the data during the last recession, and you look at just the census levels. census really didn't drop. It remained fairly constant during that last during the last recession, the 2000 the last big one, 2008, 2009.
Yeah, last big one, yeah.
So I think that I think it might have been like 1 point or something that dropped. It's not a I think most people would say that nursing homes are pretty recession proof from that point of view.
Yeah. Well, yeah, and especially compared to other industries.
Yeah.
So let's talk a little bit then about inflation and whether that is good or bad for nursing homes. That seems very black and white, but can you talk a little bit more about that?
Yeah. So inflation is I would say bad for nursing homes, and it's good potentially for businesses like IntelyCare, ShiftKey, Galen, these other kind of gig economy platforms. And what inflation basically does is it reduces your income because you can't buy as much as you used to because things are more expensive. And so people that are engaged in the gig economy will tend to work more. They'll pick up extra shifts to earn extra money so that they can kind of sustain the lifestyle that they had before. For nursing homes, you don't really see that so much unless you have some degree of flexibility in your offering. And so if it's like a very rigid schedule, then, and your census is, not changing that much, then your income is basically fixed and now your costs are going up. And so that's not so good. If there is some flexibility and you have a dedicated float pool, then you can leverage that. And those employees are more likely to be more engaged than they were before as a result of inflation. David, I don't know if you have anything to add to that, but
I think that's right. There were a couple of questions that Steve has asked here that I think are pretty important.
All right. I was just going to say too, I'll jump down to Steve next, but I was just going to say in terms of the costs, I think the data we do see that costs are rising and that people in nursing homes are certainly making choices with their money not going as far. So we're seeing the reality of that, whether this is technically a recession or not. All right. So Steve's first question that I see here is there, this is a very specific question. Is there an amount of shift differential that you have found to be effective in filling open shifts?
Yeah. And Ben is the one that created, our various pricing algorithms, and I can let him speak to this, but I think that there's not a specific shift differential. It does matter by the shift day time and the amount of other people that would be available to also take that, meaning your supply. So I think, go ahead, Ben. Instead of throwing numbers around, I'll let you throw a number around. But
no, so we actually looked at this really recently, focusing on Sundays, and Sundays are a tough day of the week for us. There's a lot of need. And it's hard to find takers for Sunday shifts. And what's great about the data that we have and the pricing algorithms that we've had is that there's variation. We've tried lots of different prices for, Sundays for years now. And the numbers can be like pretty mind blowing at sometimes. We had one of our PhD data scientists crunch the numbers just recently, and for a Sundays, she was north of $15 an hour for a differential for a CNA, which was like kind of mind blowing. But that was a point at which she was like, you would be completely indifferent between working a Sunday for your average CNA, completely indifferent between working a Sunday shift and any other day of the week. So as David said, that might not be the case.
So that would probably be like the hardest shift to fill. Is that right? Yeah. So, but oftentimes we see $2 to $3 moving the needle. Isn't that true?
Yes. For sure.
Not necessarily the hardest shift, but in getting some of the more difficult shifts to fill or the open shifts, that that's pretty sufficient to kind of move the needle.
Yes, good call. I was jumping to like the one unique exception, the most extreme,
worst
thing.
case scenario.
Most of the time, 98% of the time is $2-3 an hour, and that is we find it most effective to talk in dollars per hour and focus on the hourly rate. That seems to be the number that resonates most with the nurses that we work with.
So Steve's other question is kind of related to pay and benefits. He's asking, is there research indicating longer range benefits such as retirement contributions would be more attractive than a higher rate alone, especially for licensed nurses?
So Steve, we did an interesting experiment a little bit ago that I guess, so the short answer is that the rate is very attractive and the benefits are also important, and you kind of have to like fight against our inner nature or like our instinct to get people to focus on the long-term picture. And it's really easy to be kind of just focused on, what am I earning today? What am I making today? And not think so much about the big picture. But nurses are a little bit different. So it's interesting that you especially for licensed nurses, I think that you can have more success in selling benefits, and you're getting more than an hourly rate. I think that kind of offering is important. And it's especially, I think, good at keeping people. And it's harder to kind of lose those benefits once you have them. If you're not working and you're like, I don't know if I need this or not, once you have it, it's hard to give it up. But we did one experiment with referrals that speaks to this a little bit, where we offered, $1 an hour immediately if you sent us a referral, or to other people, kind of a randomized experiment, $100 if your referral starts working. So would you rather have $1 an hour now, today, or would you rather have $100 in, I don't know, 3 months, maybe, if your friend starts working for us? And the $1 an hour now, won the day by a landslide. It was a big difference. I think that was largely driven more by our CNAs, but that immediate gratification is kind of a gravity that you have to push against.
But I'll add one other thought here is just, Steve, I think for better or for worse, this market, particularly through the pandemic, has highly sensitized the workforce to pay rate. And it's almost kind of bragging rights. They'll share it on social media and so on. There's I'm concerned, and I'm concerned for the industry, just that we've potentially trained the workforce to focus more on pay rate than all the other potential benefits associated with it. So if you were to kind of make so anyway, potentially, I think you're going to win more in the near term until the market starts to settle down again with a higher rate than a benefit, a longer term benefit.
And if you guys don't mind, I'll throw some McKnights perspective in here too. We just did our annual Mood of the Market survey, and in that we specifically target, registered nurses who are working as DONs or other nurse leaders. And they overwhelmingly picked higher salary or more staff as what they needed most to increase job satisfaction. So we're not necessarily talking about gig people here, but the number who wanted to see improved benefits was 30% lower. So really that speaks to, they do want the pay. Even as an RN, you might be an older adult, more, thinking more about retirement. Pay was still what they wanted. So just a little perspective there. That's not quite as scientific as the research that Ben does, but the folks are the people that Steve is asking about. I
don't know about that, Kim. That sounds pretty legit.
All right. So we have time for just a couple more here. Let me scan up a little bit. Keith had a question about technology, and if the recession does come, do you see technology helping to mitigate some of the need for staff? I guess that even could be happening right now, but he's asking specifically, does technology mitigate the need for some staff, for example, in dining?
So go ahead, David.
No, go ahead. I was going to make a dumb comment. Go ahead.
All right. Well, this might also be a dumb comment, but I went to grad school in Pittsburgh. That's where I got a PhD in economics at Carnegie Mellon, and it's right next to this like massive hospital, UPMC. You've maybe heard of it. It's like a massive operation there, and went to visit somebody there, and they have like robots zipping up and down the hallway, and so like that innovation is here, but it's also really expensive, and so it takes a lot of like forward-looking investment to say, all right, we're going to, revamp our dining hall so that it requires fewer people and there's more, machinery or robots that are kind of helping out here. And so I guess the answer is yes, technology will mitigate it. I think the question is when, and I think,
I think a more closer to home answer also, Keith, might be something like if scheduling continues to make some smarter advances, and I know that the kinds of things that we're working on for ourselves is pretty exciting, that you would massively reduce the time that a scheduler would spend on trying to get their shifts fully staffed. And so you could imagine just the efficiency. So instead of being perhaps a full-time job, it becomes a 30%, of their job, and then they can, work in other capacities. Dining, I'm imagining the same way. I'm not as close to dining, but I got to imagine that there are elements of efficiency, around that. You could, going back to the robot example, there might be some automation and some things that could be added to that. But from a software perspective, I think there's a lot of things that we're still doing manually. There's a lot of things that we're still trying to, that just consumes a lot of time that I think will make everyone's job a little more efficient, which should, mitigate, some need for staff over time.
All right, thanks, David. So we're just about out of time. I'm going to take a quick answer myself at a question that we have from Nancy. She's asking, what companies have you seen implementing a float pool, and are hospitals doing the same? Because our audience is skilled nursing, I want to keep it to that, but I just want to tell Nancy, in doing some research recently, I would say that a lot more companies than you think are establishing float pools. And also, we're going to cover that in a webinar in September with IntelyCare, and we will have a skilled nursing provider talking about their strategy and why they did it and how they're succeeding with it. So I'd ask you to please come back for that. But for today, we are going to wrap it up. So I want to thank everybody for joining us, especially for David Copins, and also to you, Ben, for walking us through these issues and their insights and some of the solutions and strategies they've offered today. A reminder that this session was sponsored by IntelyCare, and you can find them at IntelyCare.com. And coming up at noon Eastern, McKnights is bringing you another 4-credit session in this online forum. You can stick around to learn about the value of vital sign monitoring, enabling proactive care. If you'd like to watch either of today's sessions later or share them with others, recordings will be available shortly, and those are at www.mcknights.com/082522 online forum. And finally, we want to thank you, our listeners. You've been a big part of today's success. Thank you for all the great questions. And be sure to come back for future McKnights forums listed under our events tab. We appreciate you tuning in. For McKnights, this is Kim Marcellus. Have a great afternoon.